Good afternoon, everyone, and thank you for joining us for today's webinar. My name is Roneen Davis, and I'm a project manager at the Council of State Governments Justice Center. Before we begin, I have a couple of technical notes. If you encounter connection or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. We'll also post that number to the chat box on your screen. Unfortunately, there are some connection issues we may not be able to resolve during the webinar. However, we are recording today's webinar, and it will be posted on our website along with a copy of the slides used in today's presentation. On today's webinar, we will review the Second Chance Act Comprehensive Community-Based Adult Reentry Program, or Community Reentry Grant. Throughout the webinar, we encourage you to submit questions in the Q&A box on the bottom right corner of your screen. We will have time at the end of the webinar to address the questions you have submitted, and we will do our best to get through as many questions as we can before we conclude today. Joining me for today's webinar is Andre Bethia, Policy Advisor for Corrections at the Bureau of Justice Assistance, and Jan Dela Cruz and Derek Lowry, Policy Analysts here at the Justice Center, who will be providing technical assistance for this grant. After telling you a bit more about our organizations, we will review the fiscal year 2017 cohort of grantees. We will then go over the grant program's history, expectations, and examples of how some past grantees addressed those program expectations. We will then discuss the support available to you as Second Chance Act grantees, including technical assistance from the National Reentry Resource Center, before wrapping up today's presentation with time for questions. Please note that contact information for each presenter will be posted at the end of the webinar. I'm now going to turn it over to Andre Bethia to tell you a little bit about the Bureau of Justice Assistance.
Thank you, Roneen. Congratulations to each and every one of you for being selected to participate in the Second Chance Act Comprehensive Community-Based Reentry for Adults. This is the most highly competitive grant under the Second Chance Act. So again, congratulations. The Bureau of Justice Assistance, our mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Many of you may have received grants from other parts of the federal government, such as Department of Labor and the Department of Housing and Human Services. Furthermore, there's often overlap in awards made by the Bureau of Justice Assistance, BJA, and other DOJ offices such as the Office for Juvenile Justice and Delinquency Prevention. It is important to recognize that each federal office takes a different approach to grants management, and that similar projects operating through multiple federal awards need to demonstrate how they are distinct from each other, primarily around how results are reported. Back to you, Roneen.
Thanks, Andre. I'm going to go ahead and turn it over to Jan to tell you a little bit about the Council of State Governments.
Thank you, Roneen. The Justice Center is a national nonprofit organization that serves policymakers at the state, local, and federal levels from all branches of government. The Justice Center staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. You can find our website at csgjusticecenter.org and can follow us on Twitter at CSGJC. In addition to serving policymakers, the Justice Center provides technical assistance to Second Chance Act grantees through the National Reentry Resource Center, or NRC, which is authorized by the Second Chance Act, SCA, and it's funded through the Department of Justice Bureau of Justice Assistance. We are constantly adding new content and resources to our website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events, and other news about reentry.
Thank you, Jan. Now I'd like to take this opportunity to congratulate everyone for receiving this award. This grant is an exciting opportunity for community-based organizations like yours to support those returning from incarceration. As Andre mentioned, there are a large number of applicants, and the 10 of you were selected, representing 9 different states and the District of Columbia. You will find that many of you have similar aspects of your programs while also taking different approaches. Part of our technical assistance process will be connecting you to the other grantees in your cohort to learn how different programs address similar challenges. We're now going to take some time to review the Community Reentry Grant Program. Under the Justice Center's Corrections and Reentry Division, I work on the Community Initiatives portfolio, which provides technical assistance to all Second Chance Act grant programs awarded to nonprofit, community, and faith-based organizations. These grant recipients stand out because the majority of Second Chance Act grants are only awarded to units of government, such as departments of corrections or sheriff's offices. While many of them may subcontract with nonprofit agencies, only a select few Second Chance Act grant programs, like this one, are available directly to nonprofit agencies, including tribal and faith-based organizations. These grants have historically required a mentoring component, and while not a requirement for the grant program this year, almost all recipients of this grant have incorporated mentoring into their program plan. In addition to your grant program, we also work with grantees who have received Second Chance Act funding from the Office of Juvenile Justice and Delinquency Prevention, or OJJDP, to run mentoring programs for young adult parents and Latino youth. BJA and OJJDP together have invested around $100 million of Second Chance Act funds in over 200 community and faith-based organizations to run reentry programs that incorporate mentoring. This funding has supported various programs across the country in 46 states and the District of Columbia. In addition to providing you with opportunities to share each other's successes, challenges, and strategies, your TA providers can connect you with past and existing grantees around the United States to provide opportunities for peer sharing and learning. At this time, I'm going to turn it back over to Andre to walk through the goals and expectations of this grant program.
Thanks, Roneen. The goal of this grant program is to support community and faith-based organizations in developing and implementing comprehensive and collaborative programs that support people who are reentering communities after incarceration and are at medium to high risk of reoffending. You must incorporate a risk and needs assessment tool to determine that information into your program. The expectations. It is important to have buy-in from both corrections agency leadership and facility staff. Case management must address needs, must conduct collaboratively with service providers, the participant's family, and the participant. You're also establishing a baseline recidivism rate that is reflective of the population being served. This should have been included in your proposal and is usually pulled from county or state data. While you may have presented a general recidivism rate, it's important to identify a baseline rate that reflects your target population as much as possible. It is equally important to be clear on how that rate is defined. For instance, is it based on rearrests or convictions, or is it 1 year out or 3 year out? All grantees should work with their evaluator early on to define outcomes. Establish an evaluation plan and set systems for tracking data. It is extremely important that grantees take a thoughtful and critical approach to collecting and reviewing data. Setting up a program evaluation plan should be a collaborative effort between the program staff and the evaluation staff. It is crucial to develop outcomes with clear definitions to show where your program was effective and where it could be improved. Evaluation should be more than a data collecting and reporting process. The planning phase is around 6 months after the budget is cleared, not from October 1. Grantees are required to work with their TA provider to complete the planning and information guide, to continue to work with them throughout the course of the grant. Please note that in order to move on to implementation and receive the remainder of your funds, the PMI Guide must be reviewed and approved by BJA. The planning phase is an opportunity to build capacity, establish baseline information, and utilize the PMI Guide to identify how the program can be stronger, to flesh out ideas in the proposal, and guide your work with your TA provider. It is important to utilize this planning phase to ensure your program is in a strong place to get started. Many grantees, understandably, feel the need to get started right away. Let this planning phase be an opportunity to make sure you've worked out certain kinks like contract finalization and relationship building, and work with your TA provider to ensure plans are in place to address areas of the program that may need more work even as you are ready to move into implementation. I'll hand it back to Roneen.
Thank you, Andre. So I just want to talk a little bit about some of those expectations that Andre laid out and how some past grantees have addressed them. As he explained, there are certain guidelines every grantee must follow for this grant. However, different programs may approach those expectations in different ways. For example, Center for Self-Sufficiency in Wisconsin, a recipient of an adult mentoring grant and a young father's mentoring grant, works in one correctional facility for their grant where they have a strong established relationship with facility staff. Because of this strong relationship, correctional staff offer to assist in recruitment. Staff have also presented on the program and led a workshop based on their curriculum with the warden, deputy warden, and the social services department, so they have a better understanding of the program. Whereas another adult mentoring grantee works out of multiple facilities and has a strong partnership with their probation and parole department, which has resulted in having a parole officer spend some of her shifts on site where the program takes place to help encourage participants to stay engaged with the program. Sponsors, another adult mentoring grantee based in Oregon, has partnered with an evaluator to conduct a randomized control trial where both groups receive the full range of reentry services, but where one group includes mentoring and one does not. Their study will examine how mentoring impacts reentry outcomes like housing, employment, and program completion. Lastly, we wanted to point out AWE, the Arizona Women's Education and Employment Incorporated, an adult mentoring grantee. This organization focused their grant on women who met all the required eligibility standards that you saw on the slide earlier, which so that included a minimum of 150 people served, medium to high risk of recidivating, and 18 and older and convicted as an adult. But they focused on women within that population. And while AWE partnered with their correctional agency to receive scores from risk assessments to determine eligibility, they implemented their own gender-responsive risk and needs assessment that provides them with better needs information to help develop their case plans. Now we're going to take some time to review the P&I Guide. As Andre mentioned, this is a required deliverable for the planning phase of your grant. In addition to that, it can be a very helpful tool for your project team and your TA provider. The P&I Guide is a tool that is meant to flesh out the ideas put forth in your proposal and identify strengths and areas for improvement. It will help to establish baseline information about the proposed program and help your TA provider target their assistance. One key benefit of the guide is that it provides a single document to reference key programmatic information. While further details may be laid out in program manuals and policy and procedure documents, the P&I Guide will be a good reference point for program staff and partners to grasp what the program is trying to accomplish. Keep in mind that the guide should be a living document that you can update as changes occur, whether they are small adjustments or formal changes that require approval from BJA. After receiving the guide, please fill it out, being as accurate, clear, and concise as you can. You should be bringing in program partners for the parts of the guide that address their involvement in the program, such as your corrections agency, your evaluator, or your treatment provider. Once completed, the guide should represent the plan for moving forward. While many aspects of your program may be ready to go, there will inevitably be pieces in the works. Make sure to clearly indicate if something is still in the planning phases or is ready to be implemented as you fill out the guide. For example, if you are partnering with a housing provider but you don't have an MOU with them yet, you should specify the status of the MOU and whether it has been drafted yet or is simply waiting on a signature. Your TA provider will work with you to develop a plan for how gaps or challenges will be addressed during implementation. I also just want to reiterate that you shouldn't go it alone. This isn't a homework assignment for the program manager. Bring in other staff and partners as needed, especially your program evaluator. They should be working with you from the beginning to address data collection, performance measurement, and other processes. So you will be having monthly calls with your TA provider throughout the course of the grant. During the planning phase, you will work with your TA provider to determine which exercises to address on which call. Please send completed exercises to your TA provider in advance so they can provide feedback and focus on priority areas during the calls. If something changes from what was originally put in the guide, make a note of that and be sure to discuss with your TA provider. Lastly, it is important to provide or develop documentation. You'll find the questions in the PMI Guide often end with, where is this documented, or what is the plan to document this information? For instance, when discussing the process for recruiting participants, think about whether this process is documented in a program guide or a policy and procedure manual that can be shared with your corrections partner or new staff who are learning how the program works. If you have existing documentation, please provide that to your TA provider and note it in the PMI Guide. This is an overview of the different sections of the guide. It is an opportunity to think critically about your proposed program, and I encourage you to have an open dialogue with your TA provider as they learn about your area's unique systems and challenges. Section 1 will cover basic information about your program, including goals for the program and a list of partner agencies. The guide will ask for specific information about how partners will be involved and the strategy for maintaining regular communication with them. Section 2 will dig into your eligibility criteria, why that criteria was selected, and how it will be assessed, including what risk and needs assessments are being used and who is administering them. This section will also ask you to describe in detail how participants are recruited and enrolled into the program. Now, the real meat of the program will be examined in Sections 3 and 4, which address service provision. This includes what individual services are provided and whether they are grant-funded, provided in-house or by referral, and which ones are evidence-based. It will also examine how your program is or will be trauma-informed, how case management is structured, and it will go into your processes for mentoring, including mentor recruitment and training. Please keep in mind that when you're answering questions like how the program is trauma-informed, be detailed. Describe the type of training staff receive, who conducts that training, and what quality assurance measures are in place. Section 5 is the big one. Program evaluation is crucial. It shows where your program is effective, where it needs work, and helps you to improve future programming. You need your evaluator for this section. It will help you to establish the beginnings of an evaluation plan, including laying out specific indicators that will be examined. While it is important to track participant recidivism, your evaluation should be robust and examine various outcomes related to your program goals, such as achieving long-term housing or sustainable employment, or whether having a mentor improves program engagement. The last section covers sustainability. It is never too early to start thinking about this topic. It's important to build resources and plan for the end of the grant early on. Start thinking about which aspects of the program could continue without Second Chance Act funds and what other funding sources you will be exploring. The PMI Guide also provides a template for developing a logic model. However, if you already have one, please send a copy of that to your TA provider. Now I will turn it over to Derek to talk to you about the support you'll be provided while you have this grant.
Thanks, Roneen. So there are 3 primary agencies that will provide you with support. BJA, as you know, is your funder and primary contact for any issue related to the functioning of your grant. Tracy Willis is your state policy advisor, and any questions regarding budget adjustments, changes in your scope of work, no-cost extensions, etc., should go to her. I will be posting her contact info later in the presentation. The NRRC is contracted by the Department of Justice to provide technical assistance, and I will elaborate more directly on the NRRC in an upcoming slide. Primarily, though, we are your contacts for programmatic support during the duration of the grant. Lastly, Booz Allen is contracted by the Department of Justice to manage your performance measurement tool, or PMT, and can provide technical support with the reporting process. Every grantee is assigned a technical assistance provider from the NRRC who will assist you in completing the PMI Guide, supporting the development and implementation of the content of your program, helping you assess progress, and linking you with other grantees in the field to share successes and common challenges. These are your TA providers, myself, Jan De La Cruz, and Roneen Davis, along with Tracy Willis as your BJA State Policy Advisor. Jan and Roneen have been supporting the work of mentoring and young fathers grantees for the past several years. Jan was also one of the authors of the NRRC's recent publication, Mentoring as a Component of Reentry. I have been supporting the work of grantees for almost 2 years now and have worked extensively with young mothers and young fathers grantees in the past. Though you will have your own primary TA contact, we work as a team alongside one another and often utilize each other for our different specializations and backgrounds. Your NRRC technical assistance provider provides support in several areas over the duration of the grant track. The provider will directly assist in the completion of the planning and implementation guide, discuss and identify proper metrics and strategies to track progress, provide relevant content to build the program, assist in the development of sustainable strategies, and share successes with stakeholders and other grantees. Over the course of providing technical assistance, several of our NRRC TA activities are used to enhance and complement your work and the local impact of your programming. Each grantee will have monthly phone calls with their TA provider throughout the course of the grant. The NRRC also regularly hosts and distributes webinars and peer learning events that are opportunities to interact with other grantees and specialists. Additionally, based on the needs of your program, we may be able to provide trainings on a number of issues related to reentry, including risk needs responsivity, gender responsiveness, the intersection of behavioral health and reentry, and various other topics. TA providers also conduct on-site visits, occasionally with other consultants and specialists, to address specific challenges on the ground that grantees may need additional assistance in dealing with effectively.
Thanks, Derek. So now what happens next? If you haven't done so already, please review the Second Chance Act Grantee Orientation webinar. This was a webinar that was presented to all Second Chance Act fiscal year 2017 grantees and covers key information from BJA regarding your grants management process. That includes your reporting requirements. You can find this webinar at nationalreentryresourcecenter.org, and your TA provider can send you a link to the recording. Your TA providers should have reached out by now to set up your introductory calls. During your first call, you will have a chance to talk about your program and any changes from the original proposal that you anticipate. Your TA provider will also take this time to walk through the PMI Guide process with you. Lastly, we are planning an event in April for active community reentry and mentoring grantees. This will take place in Washington, D.C. and will cover important topics relating to your programs and give you an opportunity to interact with other grantees. We are in the planning process for this event and will send out additional information. Now I'm going to turn it back over to Jan to talk about our recent mentoring publication and additional resources that the NRRC has available for you.
Thank you, Ronin. With support from Bureau of Justice Assistance, earlier this year, the NRC released the publication, Mentoring as a Component of Reentry, Practical Considerations from the Field. In collaboration with an advisory group consisting of past grantees, researchers, peer mentors, and correctional professionals, as well as the NRC's history of working with over 150 organizations, we were able to provide 5 areas of consideration for community-based organizations looking to provide mentoring services in their reentry program. These areas of considerations include guidance on partnering with corrections, risk need responsivity, and evaluating your mentoring reentry program. This is not meant to be an exhaustive list or a step-by-step guide, but rather a reflection of lessons learned that can serve as a valuable resource for the field. Through the NRC, we are able to connect you with other resources as well. Your TA provider can provide more guidance on the variety of resources available to you.
Thank you, Jan. In addition to the NRC resources that we just had up, there are also some valuable resources outside the NRC to be aware of. These include crimesolutions.gov and the National Registry of Evidence-Based Programs and Practices, which provide information on evidence-based practices and curricula. The National Mentoring Resource Center, which is a project funded by OJJDP, provides TA and support to mentoring programs with a focus on youth, as well as the Center for Evidence-Based Mentoring and its associated newsletter, The Chronicle, which posts regular articles on mentoring. At this time, we're going to go ahead and take questions. Please remember to use the Q&A box at the bottom right-hand corner of your screen. You can submit questions there. Just as a note, this slide has contact information for Andre as well as your 3 TA providers from the Council of State Governments Justice Center. For contact information for Tracy Willis, we had that up earlier, but if you weren't able to catch it, we will be posting these slides on our website, and your TA provider will also be able to provide that to you. So at this time, we're going to go ahead and take questions. And the first one that I see here is about the budgets. This grantee was asking when they can expect budgets to be approved. I know that it can be a different process depending on each grantee's individual circumstances and getting certain special conditions cleared. But I'll just quickly check in with Andre if there's any other comments you want to add about budget clearance.
Hi, thank you so much, Ronin, for passing that question on to me. We ask that all of the grantees be patient with the budget clearing process. This is twofold. This is on your behalf to submit all the necessary information, and then it must travel a process on the BJA side. So again, budgets will be cleared as you do your reporting part, and then we have a process on this end. So again, we thank you in advance for your perseverance and patience in this matter.
Thank you, Andre. All right, next question was about how a grantee can connect with the other grantees in their cohort. So I'm assuming they mean by the other grantees that are on this webinar. As we mentioned earlier in the presentation, that's part of our job as TA providers is to connect you to each other. So depending on what your needs are and what we've identified as what other grantees are doing, we'll be able to connect you to each other. And at events like the training event in April, you'll have an opportunity to meet with each other there too. All right. Next question was also about the budget. While we are waiting on the budget, should we work on the special conditions? I'm going to turn that over to Andre because I know that the special conditions can be different. There's different special conditions that have different requirements, and some might be pending some of the budget issues. So Andre, is there anything to add on that?
Thank you, Ronin. Again, all the grantees should be advised that you should wait for your budget to be cleared before you go to the next step. This is a long, arduous process indeed, and I know that many of you are eager to get out there and roll up your sleeves and really help the great people who are returning to their communities. However, as you can imagine, the Bureau of Justice Assistance has a long process, and it really is a process that must it does take time. So again, before we can even start on the special conditions, I think we need to get budgets cleared, because then the special conditions are actually, in many cases, a grantee by grantee basis. So not everyone, there's a set that everyone must pass, and then there's individual issues or hurdles that the grantees must come over before we can get past the special conditions. So again, I think the first step is really to kind of work on the budget, get that cleared, and then kind of talk about the process of special conditions. I encourage each and every one of you to email your state policy advisor in the person of Ms. Tracy Willis, and definitely she is definitely responsible and responsive to you all as being the lead for this particular grant cohort.
Thanks, Andre. The next question was about the TA calls and who should be on those calls. So as we mentioned earlier, you'll be having monthly TA calls with your TA provider, whether that's Jan, Derek, or myself. Generally, it actually depends on the call and the content of the call about who should be on it. But for that first call, the program coordinator, whoever's overseeing the day-to-day operations of the program should definitely be on there. But throughout the course of the grant, there are going to be times that we'll want to speak to your evaluator, your corrections partner, if you have partnering agencies that are providing certain services. It really depends on the needs of every grantee. But I think for the very beginning, having your project coordinator and actually having your evaluator on that initial call wouldn't hurt either. It's good to get them into the conversation early on. And then as you schedule each call with your TA provider, you'll be talking about what the content of that call will be and who would be most appropriate to join that call. All right. Next question. Does successful completion of the online training take place if attending the April 2018 grant training event? I believe this is referring to the BJA financial training, and if it is, those are two separate events. If you're asking about the required BJA financial training that happens online, that's separate from the April 2018 event. Is more of there'll be certain aspects of training to that, and also addressing certain content areas from within your program as opposed to the grants management process. So let me know, though, if you're talking about a different online training, and if I'm not quite answering your question, then please follow up and let me know. All right. The next question is about, it looks like it's a question about making changes to the grant. So what they're asking is if it turns out we need to add another correctional facility to our project, what do we need to do to get that approved? I think that actually is a good question about if you're making any changes to your project. If it's anything that isn't in your proposal, it's important to discuss that with your TA provider and reach out to Tracy Willis at BJA to talk about what that would involve. So any changes to your project require going through BJA for approval and need to have justification for why that change is being made. So I'll quickly turn it over to Andre and see, since those are the requests that he often has to deal with, is there anything else that you'd like to add to that?
Thanks, Roneen. No, I think you kind of said it in a nutshell, but I will reiterate, whether it's a budget modification, whether it's a grant adjustment, whether it's a change of scope, any change should be discussed with your TA provider and then submitted to your state policy advisor. In this case, it would be Tracy Willis. You will be required to upload this information into the GMS system for it to be approved by me. So again, that discussion should already be happening with your TA provider about any challenges that you may be having, because the TA provider has a great deal of knowledge and expertise on how to navigate many of those challenges. And then once it is decided on the direction that you, the grantee, will go in, then that should be submitted to Ms. Tracy Willis, and as well as uploaded through the GMS system for the approval.
Awesome. Thank you. Thank you, Andre. The next question is, what is the 180 days on the planning phase? So what that was in response to, or there's the slide that was about 180 days of planning phase. That's basically what Andre mentioned. You have 6 months from approval of your budget to complete the planning phase, and there's some flexibility there, but that's the time when you'll be working with your TA provider on the planning and implementation guide, and that's the time that, as Andre mentioned earlier in the presentation, that you should be working to make sure the program is in a really good place for implementation. We know that between the time that proposals are submitted for the grant and when you actually get the grant, certain things might change. We've had grantees who had MOUs with correctional partners who then backed out. We've had grantees who had relationships with treatment providers or other referral partners that by the time they got the grant or when the budget was approved, they weren't able to provide the same services that had originally been promised. And so you want to use that planning phase to make sure that everything is ironed out. And even if there aren't any of those major changes, what that planning phase also allows for you to do is really flesh out some of the ideas that were in your proposal to make sure you're covering all your bases and set you up for success once you do move on to implementation. All right. So there was a question about being reimbursed. How will we be reimbursed for time involved in the recruiting, hiring, and training of the project coordinator as this activity is taking place prior to budget approval? So that's more on the grants management side. So I'll turn that over to Andre.
Hi. So the concept is that you shouldn't be doing anything until your budget is approved. If you had already started to work on the grant, then that falls within your domain and responsibility. The fiscal year, which is October 1, is when the award is made. However, it requires budget approval and for you to begin to work on your PMI guide. So we don't even release all of the funds to you. You have to still complete the PMI guide. There is a process, and again, it is quite laborious. However, there still is a process. So if you have incurred any kind of expenditures at this point, that is not covered by the grant if your budget hasn't been approved and you've been notified that you actually have a budget to work from.
All right, thank you, Andre. All right, just checking to see if we have any other questions. There might be a couple that may come up as a result of some of the ones we already discussed. Okay, I'm not seeing any in our Q&A box. I'm just going to go ahead and check the chat box as well, which is another function in WebEx where some grantees might have submitted questions. All right, I don't see any additional questions, so just put the call out there one last time. If you do have any last-minute questions before we wrap up today, we do have the time to make sure you include those in the bottom right corner. You can send those to us in the bottom right corner. There is that Q&A box and that chat box. Yeah, so please submit any questions you have. We'll give it another minute here just in case there's any lingering questions. All right, and I'm not seeing anything come in. All right. Well, one thing I would like to just reiterate, so we'll go back a few slides actually to the next steps in the process, the next steps for TA slide. There we go. Oh, a little bit too far. There we go. Okay, I just wanted to reiterate. So the SCA orientation webinar, that was the general one for all Second Chance Act grantees from BJA. That covers a lot of the grants management information. It talks about budget, it talks about grant adjustment notices, talks about the GMS system that you'll be using to submit requests to BJA. So I definitely encourage you to check that out if you haven't had a chance to review it. But the PowerPoint for that is also posted. So even if you were able to sit in on that webinar, it's good to have that as a reference point. One thing I forgot to mention is BJA also provided us with a list of frequently asked questions or frequently addressed issues that we included on that posting as well. So after this webinar, when you do connect with your TA providers, if you haven't found that yet on our website, please contact them and they'll be able to send you a link to that. I believe everyone should have their call scheduled with their TA lead, but if you've had any difficulty communicating with your TA lead, please let us know and we'll make sure to get that set up. And I think that's about it. Oh, and I think we had a couple questions come in while we were going through that. Let me just pull them up. So one question was, when does our 3-year period begin? From October 1st or from when the budget is approved? So I'll turn this to Andre in a minute, but I will say the official period for your grant, if I'm correct, begins on October 1st. But there's ways we can work with you for the budget, for when you actually are implementing the services of your grant, since the budget approval process happens after October 1st. But I'll go ahead and check in with Andre about that as well. So asking when the 3-year grant period officially begins.
That is correct. It starts October 1. That is when the grant starts. It is a 3-year grant. Should you not finish, you're able to submit for a no-cost extension.
And the no-cost extensions, that's something that, again, is mentioned on that general orientation webinar. So if because of the budget approval process or if there were some other issues that might have led to your program lasting beyond that 3-year period, that is an option available to grantees with the proper justification to BJA. Another question that came in, is there a maximum for the amount of individuals that can be served? There is not a maximum. The minimum is 150 people. So every grant in this particular cohort is required to provide services to a minimum of 150 people. And one thing to kind of keep in mind with that is So while you're required to serve a minimum of 150, you may serve more than 150 people, so there isn't that maximum. It is important to determine the number of people you plan to serve based on actual estimates of the target population in the facilities you're going to be working with. So you don't want to have proposed to work with 200 women between the ages of 18 and 25 and find out that that's a small portion of the population in the facility you're working with and that you're not going to be able to hit that number. So you want to make sure that you've done your due diligence with your correctional partner to ensure that that target population is there in the numbers that you need. It is also important to determine how you're going to define number served versus number enrolled and number of successful completions from your program. Those are different metrics, and it's something your TA provider can work with you on, but you do want to make sure that you and your staff have a clear definition when you're reporting on how many people you've served, that everyone is on the same page as to what that means. And just a couple other notes on your target population. As Andre mentioned before, you are required to serve medium to high risk individuals, and that's specifically risk to recidivate, and that's based on a validated risk and needs assessment. So assessments can be conducted either by your agency, by your organization or your staff, or by your corrections partner. But risk must be risk to reoffend and be determined by this criminogenic risk assessment. So as we pointed out in the examples, a lot of grantees work with their correctional partners to get that information. One grantee in particular only received the risk scores from their correctional partner and implemented their own validated risk assessment that was gender responsive to help develop their case plans. Some grantees might be implementing their own risk assessment, but if you're not, you do want to make sure that you do get more than risk scores from your correctional partner, because those risk assessments are really meant to help identify and meet the need, give you the information you need to meet the needs of the participants. And then the other criteria, just as a reminder, participants need to be 18 or older, and their convictions should have taken place after they were 18. They should have been convicted as an adult, and they need to be incarcerated at the time of enrollment in the program. So that was a long answer to a simple question, which was if there's a maximum that needs to be served. But I just wanted to reiterate some of the other expectations around target population and risk assessments, because those are very important. But no, there is no maximum number. Okay. I don't see any other questions coming in, but I'm going to do one last check to make sure. All right. Okay, so we'll go ahead and conclude the webinar. Thank you again to Andre, Jan, and Derek, and to everyone who joined us today, and to those of you who were submitting questions. Once this webinar is posted on our website, your TA provider can direct you to the recording. We'll also have a PDF of all the slides presented today. Please remember to sign up for our newsletter at csgjusticecenter.org/subscribe. Not only does it provide you with important information about the reentry field, but that's also how we send out important information about your grant cohort, upcoming events, other important grant-related issues. So I definitely encourage you to sign up for that. If you do have any difficulty navigating to find the newsletter or in trying to find this webinar or the general orientation, please follow up with your TA provider. And if you do have any additional questions after this webinar, feel free to reach out to us. You can contact your TA providers at that contact information we had up before, and that'll be it. Thank you again, and have a great day.